So you are a legend in the world of lifestyle change, and you're best known for showing that heart disease can be reversed. So this summit is about lifestyle change for those living with diabetes. What is the connection between heart disease and diabetes?
Well, the major complication of diabetes is heart disease. 86% of people who have diabetes die from heart disease. So the good news is that over the last 40 years, we've found that these simple lifestyle changes, a whole foods plant-based diet that's naturally low both in refined carbs and in fat, various stress management techniques, including yoga and meditation, moderate exercise, just walking half an hour a day, and perhaps most important, what we call psychosocial support, which is really love and intimacy, or to reduce it even further, to eat well, move more, stress less, and love more, that these simple changes are incredibly powerful. And so for the last 40 years, we've used very high-tech, state-of-the-art scientific measures to prove how powerful these very simple and low-tech and low-cost interventions can be. And we found that heart disease for the first time could actually be reversed, not just helping preventing. This idea of lifestyle medicine is lifestyle not only to help prevent disease, but also to treat it, either in combination with drugs and surgery or often as an alternative to them. We found that we could reverse type 2 diabetes. And what's interesting is that, let me come back to the type 2 diabetes for a moment, but let me just say here that, the studies are showing that getting your blood sugar down with drugs doesn't reduce the premature mortality or the horrible complications nearly as well as getting it down with diet and lifestyle. There was a study that came out called the Accord study, another one called the Navigator study, and then both in the New England Journal of Medicine. And their hypothesis was that if they got tight control of blood sugar with drugs, that would reduce term mortality, which it turned out it increased it, and that it would reduce the horrible complications of diabetes, not only heart disease that we talked about earlier, but the blindness, kidney failure, amputations, impotence, strokes, all these bad things, any one of which would be terrible, but in aggregate are truly awful. But getting it down with, according to the American Diabetes Association, if you can get your hemoglobin A1C down below 7, which is just an average measure of your blood sugar, by diet and lifestyle, you can prevent many, if not all of these complications. And the only side effects are good ones. We also found that these same lifestyle changes could slow, stop, and even reverse the progression of men with early stage prostate cancer, and by extension, with early stage breast cancer. We found that when you change your lifestyle, it changes your genes, turning on the good genes that keep us healthy and turning off the genes that promote things like diabetes, but also chronic inflammation, oxidative stress, and the oncogenes that promote prostate, breast, and colon cancer. Just, within 3 months, over 500 genes change. And we did a study with Elizabeth Blackburn, who got the Nobel Prize for discovering telomeres, the ends of our chromosomes that control aging. As we get older, our telomeres get shorter. They're like the plastic tips on the ends of shoelaces that keep your shoelace from unraveling. They sort of keep your DNA from unraveling. And as we get older, they tend to get shorter. And as our telomeres get shorter, our lives get shorter from not only diabetes, but pretty much everything. We found we could actually lengthen telomeres in the first control study simply by making these same lifestyle changes. And, there's other studies showing that, at least anecdotally, that Alzheimer's disease in its early stages may be reversible, and some autoimmune diseases and so on. So we keep finding new diseases where these simple lifestyle changes can be so powerful, and new mechanisms to explain why they're so powerful. And so although we tend to think of advances in medicine as being something really high-tech and expensive, and with all this talk about personalization, we're using these very high-tech, expensive, state-of-the-art scientific measures to prove how powerful these very simple and low-tech and low-cost interventions can be. And we just keep finding new mechanisms to explain, why these changes are so powerful and how dynamic they are, so how quickly you can get better, or for that matter, how quickly you can get worse. So in our studies, we find that we can get people from a hemoglobin A1C above 7 to below 7 after 12 weeks. It remains below 7 after a year. And when people get put on drugs to treat diabetes, or for that matter, high blood pressure, high cholesterol levels, and so on, and they say, "Doctor, how long do I have to take these?" The doctor usually says, "Forever." And sometimes when I lecture, I'll show a slide of doctors busily, mopping up the floor around the sink that's overflowing. It's like, how long do I have to mop up the floor? It's like, forever. It's like, well, why don't we turn off the faucet? And to a much larger degree than most people had realized, including me, the faucet are these lifestyle choices that we make: what we eat, how we respond to stress, how much exercise we get, how much love and support we have. And so I appreciate the chance to be on here and hopefully to educate people that under their doctor's supervision, there's a good chance they can reduce or even get off of many of these medications, particularly in type 2 diabetes.
So this is fantastic. Now, you know, a lot of the talk about plant-based nutrition and the effect of plant-based nutrition is oriented towards the pre-diabetes and type 2 diabetes population. So does this information only apply to that population, or can it be applied to people living with type 1 diabetes as well?
I think it applies to both for two reasons. One is that it works better in type 2 diabetes, but type 1 or 1.5 as it's sometimes called, which is kind of a combination, is an autoimmune response. It's you make antibodies to the islet cells in your pancreas that make insulin. But you know, we're starting to see that these same lifestyle changes can help reduce autoimmune diseases in other forms when people make antibodies to their skin in lupus or to their, I mean, you know, there's so many different examples that I could give you. So the idea of an autoimmune disease is that your body mistakes what's real, what's you and what's not you, and it starts to attack parts of you as though it's an invader. And so for two reasons: one, it may help to dampen that aggressive immune response in type 1 diabetics. But also the major complication of type 1 diabetes is also heart disease. And we know that we can prevent and even reverse heart disease. So for both reasons, it's worth doing.
That's amazing. So this whole idea of reversing heart disease, I mean, it sounds impossible, but you've published on it numerous times in the scientific literature. What does it actually mean to reverse coronary heart disease?
Well, it depends how you define coronary heart disease. You know, most people tend to think of heart disease as the blockages in the arteries that feed the heart. And that's part of it. And in fact, it used to be thought that was the only mechanism. We know that's only one of many mechanisms. But the bottom line in heart disease is really how much blood the heart's getting. Not the blockage can affect the blood flow, but there are other things that can as well. So we've looked at both. We've looked at the state-of-the-art measures of blockages, quantitative arteriography, and found that there was some reversal of the blockages. In other words, the arteries became less clogged in the first year and even more improvement or less clogging after 5 years, whereas the randomized control group got worse and worse. And we also use state-of-the-art measures of blood flow, like thallium scans, or more recently, cardiac PET scans. And in the cardiac PET scans, also a randomized control trial, which we published in JAMA in 1995, and the blood flow, I mean, the blockages study in the Lancet in 1990, and the 5-year findings in JAMA in 1998. We found that with the blood flow, there was a 400% difference or improvement in blood flow in the group that made these lifestyle changes compared to the group that didn't. But you know, one of the things I just want to point out is that, and also we found there were 2.5 times fewer cardiac events, heart attacks, strokes, bypasses, angioplasties, stents, and so on. Now this is coming at a time when it's so interesting that just as in diabetes, it's you know, there have been several studies that both in preventing and in reversing type 2 diabetes, that lifestyle changes actually work better than drugs and better than placebo. But we're finding the same thing in heart disease as well, that the randomized trials of stents and angioplasties are showing that in stable patients, which is most of the people who get them, they don't work. They don't prolong life. They don't prevent heart attacks. And yet with lifestyle changes, we can reverse them. And again, with all this interest in personalized medicine, it's not like there was one set of lifestyle and dietary recommendations for reversing heart disease and a different one for diabetes, or a different one for, you know, for prostate cancer, or your genes, or telomeres, or angiogenesis, or any of the things that we studied. It was the same for all of them. And we found that the more people changed, the more they improved in every way we could measure. And so that makes it easy. You know, with all this talk about personalized this and that, it's almost as though if you provide your body the right raw ingredients, it can extract or personalize what it needs in order to begin healing. And it's simple. You know, it's radically simple. You know, fruits, vegetables, whole grains, legumes, soy products in their natural unrefined form are not only low in the bad stuff, like, you know, cholesterol, saturated fat, oxidants, things of that sort, but there are literally hundreds of thousands of protective substances that you find in fruits and vegetables that have anti-heart disease, anti-diabetes, anti-cancer, and anti-aging properties. Things like phytochemicals, bioflavonoids, carotenoids, retinols, you know, isoflavones, genistein, lycopene, you know, that have, you know, these very powerful effects. So it's not just what you're giving up that's harmful, but also what you're getting that's actually protective that makes this so powerful.
So this is a perfect segue, actually, because you focus a lot of your teaching on helping people understand the effect of their endothelium, the single cell layer that lines the inside of their blood vessels. So can you give us a little insight into how the standard American diet promotes inflammation in your endothelium, and how a plant-based diet can actually reverse inflammation in your endothelium?
Well, the endothelium is a dynamic process. It's just the lining of your arteries. And it used to be thought that, the arteries were like lead pipes and they kind of got clogged up with rust over time. But we now know it's a much more dynamic system, and it's living, breathing, literally, that can get minute-to-minute changes in blood flow to your heart based on, for example, how your arteries are not like lead pipes. They can constrict and dilate. They're lined with what's called smooth muscle that during times of stress causes your arteries to constrict, which is actually, we've evolved to do that for a good reason, so that if you're walking along and suddenly the saber-toothed tiger bites you, or you get in a sword fight with somebody, you want your arteries to constrict so you don't bleed as quickly. Likewise, the inside the lining of the arteries, blood clots can form. Your platelets get stickier. So if you get wounded in battle, that's a good thing. You don't bleed as much. But if it happens inside your heart, you don't want your arteries to constrict or blood clot to form, because that can keep the heart from receiving the blood that it needs to survive, and that can cause chest pain, or if it's over a longer period of time, it can cause a heart attack. And there are a number of substances that are found in, like Lou Ignarro got the Nobel Prize 8 or 9 years ago for discovering the fact that nitric oxide dilates those arteries, and so it gives more blood to feed your heart. And you find, that fruits and vegetables are loaded with substances that cause your body to produce more nitric oxide. On the other hand, there's something called angiogenesis, that when tumors grow, they secrete substances that cause blood vessels to feed the tumor. And if you can disrupt, because the tumors grow so quickly, they outstrip the normal blood supply. So if you can find ways of interrupting that, there are drugs that do that, like Avastin, but they're very expensive. But it turns out with lifestyle changes, you can do that as well. And so the more diseases we look at and the more mechanisms we look at, the more reasons we have to explain why these simple changes in diet and lifestyle are so powerful and how quickly they can occur.